Good evening, everyone. I hope you're well. I hope your weekend has gone well. I also hope it's warmer wherever you are compared to where it's been this weekend for us, because I've been freezing the entire weekend. I'm also full of cold, guys, so I apologise if there's the odd tissue makes an appearance on camera. But I hope you're well, guys. I hope you're looking forward to Easter. You're on top of everything. You're not feeling completely overwhelmed like I am at the minute with my workload. Welcome in, Snuffle. I hope you're good. I hope you're good. Slightly longer intro than normal tonight, guys. I've been dealing with a very emotional toddler. So thank you for your patience. So I took an extra minute or two to get ready tonight. Yeah, lots of time away over the last week. And he's noticing now. He's really noticing, and it's not helped that I'm streaming here tonight. I'm in London tomorrow night. I'm on being interviewed for something on Wednesday night, and he's already working out the week ahead of how many nights I'm going to be able to put him to bed. And yeah, it was rough tonight. So I'm feeling very guilty dad tonight. So I hope you guys are good. I've had an awesome weekend though. Lots of lazy sort of times with Dylan, and yesterday, sort of done a bit of shopping that with him, went around a museum, which was awesome. Welcome in, Fez. I hope you're good. Guys, you'll be able to see Fez on the show in 2 weeks' time. We're not here next Sunday because of Easter, obviously. But Fez will be joining us the following Sunday when we return. I haven't got that event up yet, guys. I will do that before Easter, I promise. Sorry, Fez, I'm massively behind. I'm drowning. I'm just drowning. I've got presentations to prepare. I've got articles to write. I'm supposed to be doing things that I don't know how I'm actually going to get there in time. So I'm absolutely drowning. But that will be up before Easter, guys. But go check out Fez on any social media platform. I'm pretty sure you're there, aren't you, my man? Where you can see a little insight about what we'll be talking about in 2 weeks' time. So I'm really looking forward to that one. Somebody that should have been on the show a long time ago and just for whatever reason not got round to sorting out between us. So welcome in, Nia. Welcome. Who have I missed? Anyone? Sorry, I've got the wrong window up. Let me get my chat window up. That would really help. Snuffle is Snuffle's discovered a drink in Wetherspoon, so I'm slightly worried about how often he's consuming it. So, guys, if this is your first time, welcome in, Amy. I hope you're good. If this is your first time here, guys, we are first and foremost a peer support community. Lots of the people you're seeing in chat here right now know each other. They're here every week. They're also with us over on our Discord, which you can find here if you want to scan that code. If you're watching on your device, if you're watching on a laptop or whatever, then you can just use your phone to scan that. If not, you will be able to find it on my bio links wherever it is that you follow. So all these people hang out in Discord all week. Really good bunch of people. So we're a peer support community first and foremost, but obviously we try to raise awareness of lived experiences and also good work and projects around patient involvement, things going on in the medical community. And tonight we'll be talking about research, which is awesome because it's an area we've probably only touched on once or twice before in the show. So yeah, really looking forward to that one. But I hope you're good, guys. And thank you. I should have said this earlier. I'm a little bit behind tonight. Everyone who supported us for Word Day at the start of the week, which I can't believe we're still in the same week. Like, my brain is that fried that I can't believe it's still the same week that we've done the 9-hour stream non-stop for Word Day. So thank you for everyone that joined us for that. We're raising awareness and vital funds for CCAA, a very small UK arthritis charity that helps families impacted by juvenile idiopathic arthritis, which is a condition that I live with. We raised £500, which is amazing. So thank you to everyone who helped us get there. And I should also give a shout out to Snuffle, who joined me on the stream as well for the last hour or two. That was really good fun. So thank you for doing that and definitely helped get me over the line. So I really appreciate it. Thank you to everyone who supported that, guys. I don't know how we keep doing it. I feel like I'm asking the same people, leaning on the same people. So I always feel very guilty. There's a lot of guilt going on this week. So for all you people that, we raised over £700 for NAS in October for the AS charity. We raised £500, 600 actually if you include Christmas, £600 for CCAA. It's just amazing and shows what a small community can do when everybody's sort of like pulled in the same direction. Welcome in, Tracy. Great to see you, Tracy. Tracy, your podcast episode is so popular the last couple of months. So guys, if you've not listened to Tracy, when Tracy joined us talking, hang on, I'm going to try and remember this, Amy. If I absolutely butcher it, please correct me in the chat because I'm having to learn a different condition name almost every single week. I think it's antiphospholipid syndrome. Have I got that right? If I've got that right, I deserve some sort of I don't know, a badge or something. But I'm pretty sure it's antiphospholipid syndrome. If I've got that wrong, please correct me. So you might remember that Tracy joined us when we were talking about artwork and how she coped with her condition and pain and things like that. The podcast has done, the version of that interview has done brilliantly. So if you've not listened to that, go check that. Look at that. I can't believe I remembered that. I can't believe I remembered that. See, I'm learning. Every day's a school day here, guys, on the Chronic Pain Club. So yeah, go check that out if you haven't already. And if I was any sort of professional, I would have done a link at that point. So let me do that now, all of 10 seconds too late. Just search Joel Nelson podcast, whatever. It used to be Joel vs Arthritis as well, so you might still find it by searching that. We didn't really talk about arthritis that much anymore, so it made sense to just ditch that and just not put a label on it. I learned that from the Chronic Pain Club, since we're not really limited to pain on here anymore either. So long story short, don't limit yourself because you never know what something's going to grow into. So guys, before I bring in our guest very shortly, again, last thank you for everyone that joined us on the last Chronic Pain Club, which was 2 weeks ago now because we were doing the Word Day activity last weekend, where we had Professor Elise Pryor join us. It was our most watched live stream here on the Chronic Pain Club ever. which was just incredible. We had uh, getting towards 1,000 live views, which is just unheard of on a Sunday night for a bald old guy with a Norfolk accent talking about these things. So to have that many people watching, and I know many people watched us on Twitter for the first time, so thank you for all the people that followed us over there. If you do want to join the conversation, please come over to YouTube, because you'll see that's where most people are talking to us from. And in a moment, when I bring our guest on, guys, the chat will go off screen. You can still talk, please do. It helps us find more people, it helps people find us. But you'll only be able to chat to the people you're watching on. So for example, Tracy, you can see he's got the Facebook badge, so Tracy will only see the chat messages on Facebook, whereas Nia Cheeks has got the YouTube badge. They will see the messages from YouTube. The majority of people are watching us on YouTube. I will share the best comments, the best sort of like stories you share, the best points you make as we go through the interview, but I do take off the chat from screen for safety, so just bear that in mind. If you want to get involved, like I say, we are a peer community first and foremost. The conversation is what we're here for, so please do get involved, support each other. It doesn't even have to be about what we're talking about tonight, guys. If you're having a bad week, or you want some advice, or you want to lean on people that understand, I've sort of come in and tried to set that tone tonight, saying I'm massively overwhelmed. You know, I'm behind on everywhere I look. I'm behind. Literally, there is not an element of my life right now that I am not drowning. So hopefully, by saying that, makes you feel like, you know, we're human here, and there's other people in chat that will understand that. There's other people in chat that will get that. So please lean on them. They're an awesome bunch. And like I say, if you haven't headed over to Discord yet, go check that out. And we also have a new Strava group as well, for Discord members. So to try and encourage people to get up and move a little bit more. A lot of the stuff I do is sitting here talking to camera. I'm a terrible advocate because I don't practice what I preach. So we're going to try and encourage each other to move a little bit more via a Strava group. So just search the Chronic Pain Club on Strava. If I know you, or I know you from Facebook or whatever, you'll get accepted in. If I don't, then join in Discord, and then you'll get accepted that way. Right, I'm going to stop talking now, guys, because I've been rushing all day and I'm going to lose my voice if I'm not careful. So we will drop off the music. I will get our guest ready, and yeah, I will take chat off screen, like I say, guys, but I will be watching and featuring the best things that come through on chat. So please do keep those messages coming. It really helps people, like I say, see us whilst we're live, which is the fun bit for me. You know, we get thousands of people watch these videos back on rewind, on demand, whatever you want to call it. But for me, it's all about that live conversation. So yeah, it really does help. So thank you very much. And I will see you all on the flip side. So, guys, I'm delighted tonight to be joined by a research fellow at the Aberdeen Centre for Arthritis and Musculoskeletal Health at the University of Aberdeen. Martin Stephen joins us. I hope you're well, Martin.
Yes, I am. Hello. Thank you for having me on.
Thank you for joining us. And let me just sort that screen. I don't know why I was doing that. There we go. So yeah, thank you for joining us and on your Sunday. I really do appreciate it. And also thanks for reaching out, for getting in touch to talk about the vitally important work that you do that we'll be touching upon tonight, because we share a lot of lived experiences here, but I think it's also really important that we get all seats sort of around the table on these topics to discuss these points. So for anyone that's sort of like not familiar with your work, and before we get in deep into sort of the research side of things, do you want to maybe tell us a little bit about who you are and your career, and how you sort of arrived to be here tonight, I suppose?
Sure. Yeah. No, that's a really good opportunity. Thank you. Well, first and foremost, I can say I can directly relate to feeling behind on everything. I think that's especially when you're talking about articles and presentations. Yeah.
Yeah,
We can
I'm
relate
drowning in a
there.
minute.
But yeah, so I'm a research fellow at the University of Aberdeen. Now, that's actually quite strange because I live on the south coast of England. So I work for the University of Aberdeen remotely. So I don't think there's a further university away from me in the British Isles. Maybe there is. We'll find out if we Google
I
Maps it. But
always welcome to have people here championing the
yeah,
benefits of remote work, and so yeah, that's good.
definitely. Yeah. I've had a varied career to lead to research. I wasn't straight out of university research. I was straight out of university into retail. Actually, I was a retailer for an awfully long time. Then I joined the civil service for 10+ years. And after that, I joined research. So I started relatively late for a researcher, aged about 36, I think I was. But as to sort of why research, you'll forgive me a wry smile there. When I was a civil servant, I wasn't enjoying my job at all. I just didn't enjoy it towards the end. And I thought, there's not really much else I can do. So I started applying for a lot of jobs. And I was living in Southampton at the time. And I applied to the University of Southampton as it was an administration job,
Mhm.
and I got an interview, and I thought, oh, let's look up what this department was and what they do. And it turns out they were a science department and an epidemiology one at that. So I had to like really start at basics. What is epidemiology? That's what I went into the interview armed with, and they asked me the same question: why research? Why now? And I thought to myself, and I was like, why? And I can tell you why, and it's the same answer I gave back then. Is what when I was a civil servant, I really felt like what I was doing wasn't worthwhile. It was at the beginning. When I first was a civil servant, I felt we were doing a lot of good. Towards the end, less so. And I really wondered why I was coming in the morning, though. Why am I spending 50 hours a week, regardless of
Mm.
the money, regardless of everything else? Why am I actually doing it, getting out of bed? It didn't feel satisfying. And I said, research, okay, I can get behind that. I hope that I'll always feel like I'm getting out of bed for a reason. I'll
Yeah.
always feel like I'm working towards something a bit greater than myself and a bit, it's kind of helping other people. It sounds like a cliche, but really that's why I do it. And I think that's why a lot of researchers do what they do as well, because actually, genuinely, it can make a difference. It doesn't always, but that's what we're trying to do. And I think that's quite a good motivator for me personally. That's why research.
Yeah, and I think that's a really good point. So the point you made there, because a lot of people sort of had that sort of epiphany, sort of like after the pandemic, didn't they? Or I certainly I'd had that sort of moment when I become a dad. It was like, why, if I'm spending all this time away from home, it needs to be for the right reasons. And so yeah, I think that's great. And was there anyone you'd like interfaced with that was in research, or were you inspired by anyone that was doing research, or was it just
Again, it
completely
was
plucked?
just it was being very unhappy in the current role and then trying to apply elsewhere. But I will say, my first supervisor, Professor Karen Walker Bone, was absolutely superb because I really didn't know a lot. So she coached me through pretty much all of it, from like what to wear, what to say, and you got a professor with a pretty busy sort of schedule. So, no, Martin, yeah, wear a shirt but not a tie. It was really down to that level.
Right, okay.
So yeah, kudos to her for doing that, because I mean, 8 years later, I'm still a researcher, so I do owe her quite a lot there.
That's brilliant. I love when people give shout outs to those, because people don't realise how important those sort of first contacts and those
Exactly.
things
I
are. That is the deciding point, isn't it? Which way
I
you
don't
go in
know.
that fork.
And I think in many ways, I still don't know how universities really work. I'm still surprised by a lot of it because I haven't been there my entire career. So I, to me, every day is a learning day, like you said earlier, and it's still interesting. And I think as well, I have the sort of ability to go, oh, that's a bit strange, if something is a bit strange, rather than just sit there and say, oh no, it's completely normal.
And I suppose for anyone that, like, I interface now with more researchers than ever through like the work I do, or I'll meet at a conference, or cross paths, but it can still sometimes, even to me, feel like a little bit of a black hole about what what it is you do. Like, we will talk about the studies in detail shortly, but is there maybe like a general overview you can give people, for anyone that isn't like aware of what that role entails?
So yeah, if in research, I guess what we basically do is, I mean, I'm an epidemiologist, so we look into sort of disease prevalence, sort of what's leading up to a disease and the disease spread. That's basic epidemiology. Then we kind of exploded that out to include a bit more social stuff, so qualitative and mixed methods work. So we actually talk to people rather than just look at numbers and data now. um, and and that's sort of like we look at, say, I mean, the quick study is about chronic pain at work, or the iPREPARE study is about the role of patient research partners in rheumatology research. I
Yeah.
guess it's just trying to kind of push forward why people have medical conditions and how those medical conditions affect their lives. It's a bit wider than, say, the simple pharma type research, that does this drug help with X. Well, yes, that's really important, but also it's sort of like, well, actually, how does this condition affect you, and how can we make that better? at, at the end of the day, the question is always, how is this going to change something? How is this going to make something better? And as long as you've got that question in mind, I think almost any research is worthwhile.
Yeah, and I think that's thank you for that brilliant explanation. And I think it's that difference is worth noting, isn't it, between like industry and academia, sort of thing, because I've seen both sides. I'm fortunate enough to have sort of gone for a tour around pharma, research, and they could be like quite cold and very scientific. And then what we're going to be talking about tonight is like very much sort of people based and helping the individual at the end of that line and everything. So I think that's a really important sort of difference to point out. And I will echo what somebody said in the comments about researchers just seem to be genuinely nice people, because I've had exactly the same experience where everyone I've come across, they just seem to be in it for the right reasons and want to help people, and I think that's pretty special. So I wanted to ask you, we're going to talk a lot tonight about patient and public involvement in research, and particularly around one of those studies. So I thought before we get to that point, it'd probably be worth us setting out, what is patient and public involvement in research, and why is that important? Like that, I know that's a pretty big, broad question, but feel free to answer that in as much detail as you like.
Well, I guess getting the public involved in research is vitally important so we can contextualize research. For a start, there's sort of democratic principle. If research is about you, if it's about your medical condition, you should have a say in how that is conducted. And crucially, of course, say you're researching a medical condition, people with that medical condition will know more about it than you. They're the experts in that condition. So their experiences should be the things that you're researching. It should contribute to your research. It should it should determine what your research is about in the first place. What's important? What should I research that will help you? And as I said earlier, having that question in mind at the beginning, who's going to benefit from this? How can this change something? That I think is really important to get people's views on, especially if they have that medical condition, because they will be the ones ultimately who can determine, say, what research to do, how to take that research forward. They can help you interpret data. Often, when I find I'm working with patient research partners, they're often just as good as research as me. I feel sort of like inexperienced, both in
I'm sure
terms of
that
the
isn't the
condition
case.
and as well, they're also very, very good researchers. Sometimes we get people who are sort of new to it, but often they're very, very good researchers too. So I guess, why is it important? It just makes our research better in every single way, every single conceivable way that you can think of. Our research is better for the involvement of patient partners. And it's something that the University of Aberdeen Epidemiology Group is actually quite good at. We have our own PPI, that's patient and public involvement. We have our own dedicated group, so we have a core group doing that. We have quite a big mailing list of people who are ready to contribute to studies. And whenever we have, say, an idea for a new study, we can run that past our PPI group and get feedback very, very quickly, because everyone's so engaged. We have a couple of very, very good committee members who are very engaged and will send out any work that we want views on, and that will come back very, very quickly, because people really do care, and that they help us determine both what to research and how to go about that.
Yeah, and I think that's probably why people like myself have such good experiences with people in your profession, because you're kind of preaching to the choir. As an advocate, sometimes you're trying to get across that lived experience matters and patient involvement matters, but with research, because it's just obvious that it helps what you're trying to do. It gives you better data, better results. You're kind of preaching to the choir, aren't you? So yeah, I think we've got a little bit of work, I think, to then broaden that and try and get others in the community on board. But yeah, I think that's probably why we would, just make an assumption there, is why we probably have such great experiences with the research community. And like I say, people like yourself so willing to come onto sort of a very patient focused show and share your experiences. So I really appreciate that tonight.
I think as well, I mean, that's changed in just, I've been doing research 8 years. That's changed quite dramatically in just the 8 years I've been working in research. When I first started out, there wasn't as much, certainly, sort of PPI work, and now it's become mainstream, and that's great. And I mean, to apply for a grant now, most of the time, I think nearly all of them, you'll need to demonstrate that you've had patient and public involvement. And that feels like a box ticking, potentially. It could be. But actually, I think, that requirement from funders is actually quite important, because it does make sure that that's happened. So yeah, it can be viewed as a box ticking. Oh, I can only get this grant if I have PPI involvement. Let's tick that box. But I've not really experienced it like that. It seems very genuine whenever I've been involved with PPI work.
Yeah, and especially like the research side, of somebody on the other side of that, focus group stuff from like say industry can very much feel like that. You'll be brought in, you realize the project is already maybe 75, 80% the way through. And like the first question I'm normally awkwardly having to ask is, well, who decided this was the need? Or, this is what was, whereas my experience with research is very much that's a consideration from the start. It's an ongoing thing, isn't it? Where I don't know if that's your experience working on the other side. It kind of be more start to finish rather than just bringing people at the end to validate or whatever.
Well, that's an interesting part of the iPREPARE study, which we'll discuss later. That's the experiences of patient research partners in rheumatology research, to be specific. But if you're talking about the sort of bad experiences, yeah, that would be sort of, the project was already determined before I got there. I couldn't really contribute. My contributions didn't make a big difference. And one of the questions we asked in our questionnaire was, how early did you get involved? How early did that study involve you?
Yeah.
What was it at the design stage, which it should be? It should be all the sort of research cycle, we call it, throughout. You should have PPI involvement. Were you involved at the design stage, or were you involved later on? So I'm not going to say that doesn't happen, that people get involved as box ticking exercises later on, but certainly that's not been my experience, thank
Yeah.
goodness.
Yeah, and that bit there about that study just means I'm just now going to race forward and we can talk about the iPREPARE study because I'm intrigued straight away my ears pricked up when you said that question was there. Because I'm thinking, yes, that's what we've been asking for years. So tell us about right from the top. Tell us about we'll start with iPREPARE study. Tell us about what
Okay.
that's aiming to achieve and what that involves.
Well, I guess iPREPARE, that's the implementing patient research partner engagement in research study. So we do like a good acronym in science,
Yeah,
and we were
I'm glad you said that all out rather than
we
me having to remember.
we were over the moon when we came up with that, but I think it's a bit cumbersome actually in hindsight. So what it's basically looking at is the role of patient research partners in rheumatology research. And what we mean by that is we're sort of looking at how patient research partners themselves, when they're involved in research, how do they perceive their role? Is it of value? Is it of value to them? Do they think they're being taken seriously? Are they on an equal footing with the researchers? Then it's asking the researchers as well the same kind of question, saying, do you think the patient research partners are making a good contribution? Are you on an equal footing with them? And it's asking them and then contrasting those two results together. That's what we're hoping to do, to see if there's any differences between the two. But with the iPREPARE study, I think it's probably easier to sort of go through a personal journey on that, how I got involved in that. I read a
Yeah,
paper
please.
by one of the professors at the University of Aberdeen called Sean Treweek, and I think it's called Getting It Wrong Most of the Time. And what that said was they'd sent out sort of the primary objectives of a certain amount of randomized controlled trials. That's a type of study. They'd found the prime objectives, listed them out, and they sent that to a group of PPI, patient and public involvement people, and said, okay, can you rank these for us? Which is the most important, which isn't? And their rankings, perhaps unsurprisingly, came out very, very different to how the researchers had said, this is our primary, this is our secondary, we're looking at this, but it's not quite as important. And the conclusion to that paper was, we're often asking the wrong questions. And I thought, well, okay, that's really interesting. To me, that was okay. We can do something with this. I'd like to take that a bit further, and that developed into, there was a funding call from NewLaw saying, okay, this is about research methods. How can you improve our research methods? I thought, well, okay, we can do something around this in rheumatology research. And are we asking the right questions? That's how it started out. And then I was very lucky that one of the ULAR Parry group, Martin DeWitt, got involved. He's one of our co-investigators. He's
And just for
absolutely
anyone, sorry for
superb.
it isn't familiar with that, that's the young people with sort of arthritis, isn't it? Off
I
the top of my
think
head.
I think Parry is just generally the
Oh, just
public
in general, people
involvement.
with
Yeah.
sorry,
And
my fault. Yeah,
yeah, so we actually had Martin involved from the beginning, and he was absolutely superb. And he was like, yeah, it's a good research question, but we can modify this. What I want to know is, because rheumatology research, it was kind of an early adopter of PPI. They said Martin was saying, okay, well, we already have PRPs. We already maybe are asking the right questions. What we should really look at is how people are being sort of involved in research. I want to know actually more about their day-to-day roles. And it's like, okay, yeah, no, we can definitely do something with this. And we said, okay, what we'll do is we'll co-design a questionnaire and a set of interviews. And how that came about was, okay, I don't know anything about co-design. I'll look that up. And it turns out co-design, as it's not a complex term. It means you design things together. But being a scientist, being a researcher, I was like, well, okay, there must be a tick box list that I can go and do. If you are doing this, you are doing co-design. And again, unsurprisingly, there isn't. That's surprising from a research perspective because usually you want to tick boxes.
Yeah.
But it turns out that in the literature, in other scientific studies, when you do co-design, a lot of people use it in different ways. But the crux of it, and there was a paper by someone called Sarah Knowles, and she's absolutely phenomenal. It's a great paper. It's about a set of ethics. I think the paper's called More Than a Method, and it
Right.
really is. Doing true co-design is more than a method. It's about how you treat people and whether you do things authentically or inauthentically. So I could do a checklist and say, this is co-design, A, B, C, D. But it doesn't mean I've actually listened to anybody.
Yeah.
So, and I think that was again part of the crux and the genesis of this study. So what we did then was, okay, we got the grant and we decided to get together a working group of people with rheumatological conditions and researchers and co-design a questionnaire and a set of interviews. And that was across Europe. So we got 5 people with conditions, 5 other researchers, and got everyone into a room remotely and said, what should we put in this questionnaire? It was really sort of that simple. And that went back and forth. We had a great time doing it. I think we had 4 2-hour workshops and a lot of communication in between by people saying, this is important, that's important, include this, don't include that. And I think we came up with quite a good questionnaire in the end to say, okay, you're a patient research partner. How do you think your role's going? What have you enjoyed? Do you think you're being taken seriously? Were you involved early enough? Things like that. Were you paid for your role? And then asking the same type of questions to researchers. And we hope to compare those two at the end, which should be quite interesting, I hope.
Yeah. Yeah, no, I think that's a really great point in there because as somebody that's been involved in some of that on the other side, like the amount of times where it's like, this is what our doctor told us that is important to the patient, and then I feel really bad. I'm answering it completely oppositely, and then somewhere you find sort of a happy medium in the middle. So it's really important to get those. Are you actually asking the right questions? Because you can get all the data and results in the world, can't you? But if you're not asking the right questions or aiming them at the right people, then it's kind of a pointless process.
Very much so, yeah. And it was a learning experience for me because I'd had some patient involvement in my research up to now, but it was really exploding that outwards. And I remember advertising for the working group saying, if you're a patient research partner with experience, or if you are a researcher with experience of patient or working with patient research partners, please email this address. I remember sifting the emails and thinking, as a sort of study lead, I should stand down because everybody had more experience than me. It was really, really, really engaged people. And yeah, it's about asking the right questions, and those right questions were determined by that working group. So it was really a really interesting process.
Yeah, and as someone, I appreciate this might not make a lot of sense to people outside of the UK watching this because we have a lot of people in the US watching. But as there's the NHS peer leadership program now, which I've done, which is amazing. It's sort of like talking about patient involvement and that sort of thing, and that really got me thinking in a different way in terms of like being equal partners in those conversations and that work as well. Because up until to a point, I probably sort of changed my approach and got a little bit more firmer with what I would get involved in and wouldn't get involved in a year or two ago. But up until that point, it was great to be involved, but you never really felt like the things were weighted, in a correct way, or if it went to a vote, or I'm talking about focus groups, everything a lot broader than just what you're doing with that study. So that having that parity and that sort of being treated as a peer, and that is really important as well, isn't it?
Very much so. And I think that's part of the evolution of the whole process, because I think if you went back 10 years, maybe even 5, that was certainly the case. Oh,
Yeah,
we'll involve people with the condition, we'll listen, but we might not really change anything. And that's just not acceptable now. That's not how we'd aim to do things, because, as you said, you'd hopefully be involved in the research as a peer. And
yeah,
yeah, that means that sometimes you have to be flexible in that, okay, if everyone else wants that, okay, let's do that. Sometimes that's the case. But as you said, being a peer is really, really important, because then it's about mutual respect, isn't it?
yeah.
My view holds as much weight as anybody else's, and therefore I'm going to be listened to. So even if, say, my question doesn't go in the questionnaire in the end, I know I've still been listened to, even though
Yeah.
that one thing hasn't happened.
Yeah, they're brilliant. And I feel like I should also, because many of the people that watch the show or listen to this back on the podcast are sort of patients or engaged people. And there is a really good course, which I'm in the middle of. I'm quite early on. I'm a little bit behind. Don't tell EULA this. But there's a EULA course that is aimed at patient involvement in research specifically. It does cost a little bit of money, but I would highly recommend it. Or if you can work with a patient organisation or someone to help you maybe get on that, because yeah, I've found that really, because research is just an area that I've been involved a lot with, like campaigns and project stuff and industry, but yeah, research was an area I felt like I was personally sort of like, it was a bit of a black hole to me, and I could do more. Yeah, and it's amazing that resource now even exists, because like you say, you go back 5 years ago, that you're not going to find that on ULA's website, are you? So we must be moving in the right direction somewhere along the line.
I think that's an important point too, is that research as well can appear very, very complicated, very, very high level, very inaccessible, but it's not. I joined it, sort as I said, as a 36-year-old, thinking, I don't know anything about this. How am I going to do this? All these terms are completely new to me. I don't understand even the way in which my peers were talking. Yeah, it was quite intimidating is the wrong word, because they were all really, really nice, but I felt like I had to be quiet a lot of the time rather than actually say, hang on, that's a bit odd. Can
Yeah.
someone explain that to me? But it is actually, research is in and of itself quite accessible. It's quite simple when you boil it down, and it's getting past all those barriers, past all that language, past the way people speak. Once you boil it down, you can always ask that question: how is this helping? Is this, certainly in medical research anyway, how is this helping? What are we trying to do? Okay, let's come back from that point and then go into some more complex methods, but it is still fundamentally quite simple.
Yeah. Yeah, no, that's amazing. And I also think you speak brilliantly on this, so you're clearly carrying a lot more skills than you're sort of giving yourself any credit for, in terms of coming into this sort of like on a slightly sort of a different angle, or not straight out of university. So yeah, thank you for all you're doing on this. And I say, you being here tonight just demonstrates your interest in involving everybody. So yeah, I really appreciate that. In terms of this study, then, what's the timeline when you expect and to get data together and results
Yeah,
and everything else?
it's 1 year, so it's very tight, and that
Yeah,
includes, say, going for the ethics application. That includes getting the working group together. That included co-designing the questionnaire. So that was sort of a lag. The the questionnaire is open for responses, but that has to close tomorrow morning. So once we've closed that, I'll spend a little bit of time having a quick look at the results, but then we'll be back to the working group to fully analyze those results, and then draw up the interview stages. So I haven't actually looked at the data yet. That will be very, very interesting when I do. So I can't give you
yeah.
any results at this stage,
No, I
but
wasn't expecting that as
it
well.
should be done sort of by late summerish. We should have
Superb.
A, looked at the questionnaire results, and then B, done the interviews. So yeah, it's a 1 year study. It's a very quick turnaround. But as well, sorry, I was just
No, yeah,
coming again.
no.
Part of co-design as well is about valuing the journey rather than the end point, which is
Yes.
very
Yeah.
tricky for us researchers. That's very hard.
Yeah,
Yeah,
that must go against the grain a
yeah,
little.
very much so. I want the numbers, the articles, the conference abstracts. That's what
Yeah.
we get assessed for. That's the bit that goes on our CVs usually. But actually, I can genuinely say I've learned so much, and thank you to the working group in iPREPARE for that, because it's really just been a massive educational thing for me. And we made a good questionnaire. I am proud of it. We all should be.
Yeah, superb. And yeah, I have shared. I will just do it again on screen, but in the YouTube chat for anybody that's watching this live or watching the video back, there is a link there to the study for anybody that wants to know more. And yeah, please do feel free to reach out if you want to come back and share that with us. You know, when that's all published,
That
and
would be great.
yeah,
Yes,
that'd be
thank you. I'd
amazing.
love to do that.
Because it's always good to sort of, you know, we don't always get to hear the end goal with some of these things. So yeah, it'd be great. So obviously that's just, and this is why you're a perfect guest for our show, because we've talked about patient involvement, which is something I bang on about every week. So it's nice for somebody to do it in a different voice from a different perspective. But also your other study is a subject that's quite close to my heart as well. So if would you mind like sharing a little bit about the quick study as well?
Well, yeah, the Quick is a wonderful study. The Quick is a study that I was kind of parachuted in on. I joined the University of Aberdeen after working at the University of Southampton for a while. I did my PhD at the University of Southampton. That was where I met Professor Karen Walker-Bone, who I told you about earlier, who's absolutely great. And then at the University of Southampton, there's a group called the Centre for Musculoskeletal Health and Work. That kind of migrated to Aberdeen, and I kind of migrated with it as well. And the Centre for Musculoskeletal Health and Work is what has includes Yellis Pryor as well,
Yeah,
who
it's
a
an
lot of your
amazing
guests
team
met
you've
2 weeks
got.
ago. Yeah, I
Yeah.
couldn't believe that connection as well. And I think I saw her last week as well. We were on
Yeah,
literally
I saw you
talking
on the
together.
same sort of
Yeah.
stage in a way. I was like, I feel
Oh,
like if there's anyone else at your institution or that team that I haven't now
yeah.
covered or offered an interview opportunity, I feel like I need to do it for fairness now.
Yeah, definitely so. But yeah, and so the sense of musculoskeletal health and work, it's actually something I feel quite strongly on. I really genuinely have an interest in sort of workers' health, workers' rights. So that clicked with me as a sort of topic area. And the quick study is a study, it's quantifying the impact of chronic pain on work.
Mm,
Now that's an interesting title in itself, but what we thought when we first started out with that was, okay, chronic pain clearly affects work. We know that. But actually, we think when people gather information in questionnaires, which is kind of the main way that data is gathered in a lot of these sort of mixed methods research, you'll be sent a questionnaire saying answer this, answer that. And we thought that actually those questionnaires aren't doing a very good job of capturing the impact of chronic pain on work. I think yeah, we thought we could do better potentially. Started out doing that by doing a literature review, and that was guided by a researcher called Anne Stagg, and it was absolutely fantastic piece of work. It was what we found when we looked at prior studies on chronic pain and work. We found mainly quantitative papers. So that's mainly number-based papers,
mm,
but things about questionnaires asking a mass amount of people. And how they reduce chronic pain and work down was usually something in and around productivity. How much productivity did you lose?
yeah,
How many days off did you lose? How many times did you display presenteeism? And when we looked at that, it just suddenly clicked. It's like, okay, yeah, that's really negative. That really is A, very, very negative. And B, it's just one dimensional. It's just saying over and over again, chronic pain at work is a cost to the employer. That's how it was coming
100. Yeah,
across.
yeah,
And again, I mean, this is going back to what we were saying earlier. If these studies had PPI, or PPI was stronger back back in the past, you'd get a more multi-dimensional study. Of course, I mean, chronic pain at work, sometimes, yes, it may lead to a slight productivity loss. No, I don't think that's sort of controversial in itself,
no,
but
no,
that's not all it is.
yeah,
That's just missing everything.
yeah. Focusing
And
just on that bit is the problem, not the
yeah,
fact that that's an element of it.
and then it also had qualitative papers. These are papers based on interviews or focus groups. This is things that people say. So when you start talking to people about chronic pain at work, it was clear that there were many, many more things, but that wasn't represented well in questionnaires. We're still trying to design, and this is what Quick is doing, we're trying to design a new questionnaire tool that captures the impact of chronic pain on work. That's what we're doing. So it's kind of bringing these qualitative ideas, these things that people talk about, into a questionnaire where we know that everything's quite one-dimensional. So, okay, that was the literature review. What we did after that was we had a lot of focus groups. We had over 50 people, no, I think it was 50, bang on actually, 50 people
Right.
in focus groups. People with chronic pain at work, people with chronic pain who had left work, and other collaborators. These were employers or policymakers or researchers into chronic pain, and had focus groups with 50 people and said, okay, this is what we found in the literature review. We made a lot of mini videos. Can you tell us a bit about your experiences? And unsurprisingly, you'll be shocked to hear it wasn't all about productivity loss. There was an awful lot of other things going on that it was clear that we just hadn't asked about before. And again, that made the opportunity very clear that, okay, there's a lot more we can ask about. How do we go about doing that? And we designed a questionnaire based on those focus group responses. So Quick wasn't a sort of co-design method. That it, it wasn't that completely, but people have been people with chronic pain have been involved in so much of Quick
Yeah.
that actually I feel it really does represent the views of people with chronic pain at work quite well. So what we did was we took those focus groups, 50 people, and we boiled it down to, okay, what's the essential themes in here? What are people talking about?
Yeah.
And we boiled a draft down to, I think it was about 15 questions in the end. This is what's important to people. And it,
Yeah.
as I said, it wasn't productivity loss. And the other thing that people really didn't like was being reduced to numbers. So rate your pain on a scale of 1 to 10. How does it affect
It's
your work?
infuriating.
7. And
Yeah.
people were literally saying that in focus groups. I think it's sort of like, yeah, some days I'm a 9, some days I'm a 2. Doesn't mean I'm ever a 6, that
Yeah.
kind of thing. And it's like, okay, so we can't make this all about numbers either. Got a draft of a questionnaire together. And it's like, okay, fine and dandy. How are we going to test that? Well, we needed to refine it. So we did what was called a Delphi study.
Mhm.
What that involved was, again, more focus groups with people who have pain at work and saying, what do you think of this? Have we got the right things in here? That was followed by a questionnaire saying, do you think we've got the right things in it? Can you tell us whether we've hit this? Is it relevant to your experiences? And this was actually quite nerve-wracking at the time because people could vote them out. If
Oh,
they
okay.
didn't like the question, that could be gone. I mean, you shouldn't get too attached to your work, but really, yeah, it felt quite nerve-wracking and sort of, oh, yeah, and people don't like that question. That could be, yeah, I've spent a long time on that. Luckily, they all passed those thresholds. We made a few changes. We reduced it to 14 questions by merging a couple. Again, it's unsurprising because we designed the questions based on what people had told us.
Yeah.
And the same people, well, it was a different set of people, but again, people with pain at work were saying, okay, yeah, no, that is relevant. That is, you're along the right lines there. So that was a real relief. Um, and now we're into sort of formal testing. We have a draft of 14 questions and we've sent that out to people with pain at work on a sort of bigger scale. We have about 800 responses now of people actually just filling in the questionnaire as we have it. And yeah, hopefully we'll be able from that to refine it a bit further and then produce a new questionnaire tool that actually captures what people with chronic pain say say their pain affects their work in some way. Now,
Yeah.
I can actually tell you a couple of the things we put in there and let's
Yeah.
see if it kind of resonates. Um, One thing that people said a lot was that their pain fluctuated. And when trying to manage work, that made managing work sort of trickier because you don't know on one day whether it be a good day or a bad day. Good day, bad day. That kept coming up in the focus group. So we thought, okay, let's put that into the questionnaire. Those exact terms: good day, bad day,
Yeah.
fluctuating pain. I have a good day, I have a bad day. So, and the bad day comes back to that sort of productivity thing again. Like if you have a bad day, where your pain was worse, did this affect your work? Is essentially what it's asking. Well, yes, that's what we know other questionnaires have done, and they've done that a lot. But
Yeah.
then what people also told us was when I have a good day, well, I work a lot harder. I make up for that quite regularly. So overall, I'm not less productive. I'm definitely not less productive. If anything, it makes me work harder and longer hours. And it's like,
Yeah.
again, suddenly that clicked and it's in the same question now. So, yeah, there is an opportunity to say, I had a bad day. It affected my work. There's also straight under it an opportunity to say, I had lots of good days or a good day when I made up for it.
Yeah, and
And
that's really important because we'll have like our like pain management. We'll be talking about how you've got to pace and you've got to do that and do this and do that. But if you live with chronic pain, such as I, you're well aware that you don't know when that next bad day is coming. So the tendency to overdo it on the good days because you don't know what tomorrow looks like, and yeah, so that's a really important point. So yeah,
which
pleased to
brings in
hear that.
another of the questions, actually. We haven't quite formulated what the topic or the theme is called. I call it recharging. I don't think it's the best description. But what a lot of people with chronic pain at work were telling us was, I'm fine 9 to 5. You wouldn't know I have chronic pain because I work through it.
Yeah,
Where this affects me is that when I get home, I can't eat, I can't sleep properly. All I have to do is recover because I know that
yeah,
to pay my mortgage, I need to be at work at 9 the next day. And it's like, again, that's really important because you might not be seeing that at work. An employer might not be seeing that. That's not a productivity loss. That's nothing about your productivity. You are going all out to make sure you perform at work. But actually, that's having a huge impact outside.
so is
You going to work is your whole life. That's what people were telling us.
yeah,
Sometimes this happens. So we've got another question about impacts outside of work. So it's like, okay, does it ever stop you seeing friends? Does it affect your family life? Those kind of things are in there as well. And that proved one of the most popular questions, actually, because it's called the impact of chronic pain on work. You could argue that that's not part of work. I would argue quite the opposite because I've
yeah.
spoken to quite a few people with chronic pain at work, and they said this is the most important. That time and time again, this keeps happening. So I thought that was important. That's in there as well.
Yeah, I call it survival mode, and that is just everyone's got different words for it, but it is that terms of like you prioritize work, and then it's all the other areas that you suffer, and then by nature it makes you miserable because you've got no life outside of work because you're spending all that time trying to manage a condition to prioritize this one activity in your life.
And as far as I know, people really haven't asked that up to now. And as you were saying there, I could imagine that would have lots of other implications leading up from that. Maybe that's linked to loneliness. Maybe that's linked to mental health and depression.
Yeah,
We don't know because no one's really asked that yet. So that, to me, that question in quick is almost a precursor into a lot of other things. If people come back to us and say, yep, this is true, this is true, this is true,
yeah,
I
you're
don't
opening up
think
a
that's been
whole
measured before. And that's how research works, is that
yeah,
suddenly you see this niche. But of course, we didn't really see that niche. That niche came to us in the focus groups from the people who have chronic pain at work. So although that wasn't a PPI exercise, that was still including people with pain in our work. And that's why it was absolutely fundamental, because I think that the questionnaire tool we've designed is much, much better than anything that's come before.
yeah.
I'm you may have noticed I'm not the most confident person a lot of the time. I am confident in that
That's definitely
questionnaire.
not coming across, Martin, at all. You're speaking brilliantly. This is amazing. But like, I think what was really important is how you've explained that journey with it. Because some people will see, and I've had it before, where I get a little bit like questionnaire fatigue or whatever, especially if you start seeing numbers or a score out of 10. Because people like me, I've lived with a condition involving pain most of my life. I'm just bored of somebody asking me how much does it hurt and where, because that's not what matters to me. What matters to me is, can I do what I want to do with my son, and can I provide for my family, and can I do my hobbies and have a day where I'm not, struggling with mental health as a comorbidity in my condition that nobody's asking about. So I think explain and how you arrive to those questions is so important. And I really hope we can reach people, if I can just clip that bit and get it out there, to know that, there is that patient involvement, there's the focus groups, there's a questionnaire, then another focus group, then another round of, to get to that point, because I think just so many of us had those bad experiences, and work's the same. You go to work and they'll ask you about what's keeping you off, and sometimes I'll do it, I'll just say, oh, it's pain. I don't explain to them that I haven't slept in 2 days, and that's then brought on depression or negative thoughts, or worse, or the fact that I couldn't do the things I promised my son all weekend, and then that sent me down a dark path and I didn't sleep, therefore I got. Sometimes it is just, we don't help ourselves when we just say, oh, it's just pain, because people don't understand that. They don't understand how those elements of the ripple effects of chronic pain impact your work and productivity and absenteeism and all that sort of stuff. So yeah, I think it's really important, this one. And you are, like I say, perfect guest and the perfect 2 studies. So thank you for sharing.
Again, it's worth looking at for you or any of your viewers, listeners. What's that?
There'll be both.
Podcasters?
Yeah, both.
Yeah.
There'll be people
Sorry.
consuming this in various forms.
Again,
Yeah.
that the information about Quick is up on the University of Aberdeen website. It really is worth a look. We're very grateful to both. We have a study PPI group. We're grateful to the participants there, and everybody who's participated in Quick, whether it be a focus group or through the Delphi exercise or even answering the questionnaire. It's again been a journey. It really has. From, okay, we spotted perhaps a niche. What does everyone else think? Oh, okay, yeah, now we can start building something. And although, again, we're very proud of that questionnaire, it really does come from patients every time. There's not a jot in it that doesn't.
Yeah, no, like I say, just the things you've discussed without me prompting, which I would normally be a recurrent theme on the show, from people sharing their lived experiences, shows that you can tell when it's a tick box and when it's sort of like genuine involvement, and that comes across loud and clear. And so, what's the timeline for this one?
That's almost finished. It was a sort
Right.
of a 3-year project that should be finished this year and finalized. We designed it primarily as a research tool, so it'll be used in other research studies. But I gave a presentation. It was the Center for Musculoskeletal Health and Work. It's where Yeliz was sort of 2 speakers
Yes.
after me.
Yeah.
That one, and I gave it there, and the sort of engagement from places we weren't sort of expecting, other stakeholders going, I could use that for this, or oh, actually, I could use that for. People putting their hands up. Have you considered using it for this? No, but that's a really good idea. Let's talk about that afterwards. So we're quite excited as to where it may get used in the future. So, and yeah, I don't think, just to confirm, I don't think there's any numbers in there. I don't think there's any 1 to 10 scales. I think I made sure there wasn't
Patients, you love that.
any.
I like to say, there is places for it. We know that. Like
Yeah, of
I say,
course there
that
is.
somebody that's been seeing rheumatology, dermatology since I was 10 years old, and the first 2 questions, like 9 times out of 10, is what hurts. Where I'm done with it, because maybe when I was 15, that was the thing that bothered me the most. Now it isn't. It's about how it impacts my wife and my son, and
Yeah.
and you've got a family. You understand that it's that bigger stuff, and like the refusal from both employees and sometimes medical professionals to talk about that other side around mental health. And to me, it's a comorbidity. I didn't have mental health challenges until I got psoriatic disease, and the physical and emotional stuff that comes with that. And people don't ask because they're not equipped to answer. Like, I try hard to educate both patients as well as the medical community in this, and sound like we achieve nothing by just all shouting at each other. Like, we're all trying to achieve the same thing. People don't have the time. People don't have the tools. So we know why. I know why. Previous managers of mine didn't ask me how I was feeling, because they didn't know what to do with the information. And that's the same with some medical professionals. But I think this is where research is really important, because if you can put a big flash and light over those issues, it becomes very hard to then ignore, doesn't it?
Very much so, and I hope that's what Quick and even iPREPARE will actually achieve, is to say, okay, this isn't quite working, or that's a real issue. We need to look at that in a lot more detail, because this is obviously very important to people, and we've not looked at it up to now. How can we make this better? I guess that's the focus of most research. I hope it is anyway.
Yeah, and it really comes across, and your passion for it really comes across as well. You certainly wouldn't know that this was like a career change thing. Like you just seem like the perfect person for it. So thank you for
Thank you.
coming on and sharing
Very
and reaching
flattering.
out, and both to you and Jaleese for making me aware of the amazing things going on at Aberdeen, because that was just not on my radar that at all. So now I'm thinking, right, I need to speak to more people, understand what's going on there. So yeah, thank you for that.
Yeah, it's a good team. I enjoy working there. We're yeah, it's a good place to work. It's fun.
Brilliant. Well, you are absolutely, you don't have a choice now. You're coming back to share. I've seen
I would
far too many positive
absolutely love to
comments
come
in the,
back.
we have a very sort of like attentive, considerate audience on this live show, and they get very quiet when we're interviewing, but I've never seen so many positive comments during an
That's
interview,
kind.
not for a long while anyway. So yeah, you must come back and share that. That would be amazing. I'd love to hear about it. And yeah, and thank you for, this is the stuff that, if I'm just being really selfish here as a patient, not as like an advocate for others or whatever, as a patient, this is exactly the sort of stuff I want to be talked about. I want to be shining light on, how chronic pain impacts work, and working with that language and that terminology, because like you say, it's very focused on how it impacts the employer. It should be about how it impacts me and what I want to
Agreed.
achieve. And like you say, with the iPREPARE one, that's right up my street. Like I say, as somebody that's done the NHS peer leadership stuff, and he's currently going through the ULAR training program as well. That's just awesome. So I think it's probably worth shouting out to those wider organisations as well, and those people that come before you that have you've name dropped a few. So thank you so much. I'll be go looking at those papers because it is changing. Just in the short time I've been doing all this, I have so much more hope, and I really hope what you've come on and shared tonight gives others watching this a little bit of hope that things are changing as well. So thank you so much.
No problem. It's an absolute pleasure. Thank you very much for having me, Joel.
You're welcome. And just before you go, because I'm well aware I've kept you over time, so thank you so much for sharing all of that. Is there anywhere where people can find you, or if anyone wanted to ask more questions, they could?
I'm on Twitter. Obviously, if Twitter's not what it was, is it?
No.
I think I'm at Mark J Stevens on there.
Yeah.
You can also contact me through the University of Aberdeen website. If you go to the University of Aberdeen, type in Martin Stevens. And although I live in Devon, there is actually a professor called Martin Stevens at the University of Exeter. That's not me. One of my family members made that mistake on Facebook. Don't bother him.
It could be worse. There's a famous American cowboy poet called Joel Nelson, and,
Really?
and I get the odd message
Amazing.
from some people thinking that's me. So which is always entertaining because they're so left field and out of context of communication. But there, I've tried to share the links we've talked about on screen for anyone that's watching this either live or watching it back. I'll put those in the description for anyone listening on the podcast. But guys, if you just search Aberdeen quick study, Aberdeen iPREPARE study, I found it straight away, and I'm sure you will too. Martin, thank you so much. I know we're gone over, and also I'm well aware of I've got a stinking cold, and I started the show by saying how I was overwhelmed. I can't believe it's the same week this Word Day, Nadex, and all these other things has happened. So thank you for tolerating.
Thank you, Joel. You're super busy, and you keep doing this for everyone.
I feel like I haven't been 100%. So thank you for putting up with me, and yeah, I'd love to have you back again.
It'll be a pleasure. I'll see you soon.
Enjoy the rest of your evening. Bye-bye.
Cheerio. Bye.
Oh, guys, I've never seen so many lovely comments. I've never seen so many lovely comments in. I knew you'd like it, but sometimes, we're known on here for sharing lived experiences, and sometimes people don't. If companies and who are focusing on like eczema and stuff like that, and sometimes if it's sort of like outside of the norm, people won't give it a chance or take a look. And I think tonight is a perfect example of why we're expanding what we do here, because it's different sides of the same conversation, and why should we, if I'm sitting here most weeks talking about patient involvement and saying that we should be peers in that conversation, it therefore makes no sense that I don't bring others in that conversation from the other side to be peers. So I think the last couple of weeks have been really special on here, guys. You go back to when we had Barry, who I see has been in chat, so welcome in, Barry. I hope you're well. I'll see you soon. Barry coming in talking about HS and HS Ireland. Obviously, we had Elise. Before that, we had Professor Augustine and Rachel Sommer, that are just amazing people and have far too much belief and support for me, and just they kind of got this whole ball rolling. So big shout out to those. And like I say, you only have to look at who we've got coming up in the coming week. So next week is Easter. I won't be here next Sunday, but we have Fez, who's does amazing things around kidney disease, and coming on. And then we've also got the people behind ASIF. I don't know what they like to go as, but the International Ankylosing Spondylitis or Axial Disease sort of global organization, basically the IFPA equivalent for AS. Joe will be joining us from them to talk about the amazing work they do ahead of EULAR and everything as well. That'd be great, because I'm hoping to catch up with those a bit more at EULAR this year. And we also have Vanessa joining us from the AMR narrative, who will be talking about antimicrobial resistance. I really hope I got that right. Like I say, I'm having to learn new acronyms and words every single week on the show. So you only have to look at the guests coming up, and it's that lived experience mixed with leaders in the field and people running organizations, and like Martin tonight and Yelisa before that. It's amazing. And thank you, TJ. It's people like you guys as well that came before that set that tone, showed that value that we do offer by here. And like I say, guys, the numbers every week just going up and up and up, and we're reaching more and more people. Chat is getting more and more busy and supportive, and it's just amazing to see. And don't take, when I come on at the start of the show saying I'm struggling or doing this and that isn't negative. That isn't I don't want to be here. It's me being real and showing you that this stuff is like a reality. There's no point me coming on and trying to be like a YouTuber, or my views on influencers and Instagram and everything else, because that's BS. I'm not going to swear. I'd swear on Twitch. I'm not going to swear here. That's not an accurate picture or portrayal of what our life is. Like we were talking tonight with Martin about chronic pain. It's not just about how many days sick I've had. It's about the crap that I've had to go through outside of those 8 work hours, just to try and get in the next day, the lack of sleep, the depression, the, thoughts of suicide, whatever it might be. So you're only going to get that one side of me. So if I've got a cold, if I'm overwhelmed, if I'm drowning, I'm going to tell you, it's not because I don't want to be here. Literally, I've said this numerous times. This is like the highlight of my week. It's the thing I get nervous about most, which tells me it's the thing that matters the most. I will pitch up on Twitch and stream for 8 or 9 hours like we did on Monday, fundraise and everything. And that's just like hanging out with friends. That's great. But I think when we're doing this real important awareness stuff, shining spotlight on this stuff that someday, it might not feel like it now, but someday will have a genuine impact on tomorrow's patients. That's what really matters to me, and it's why you don't see me doing the whole story share and stuff as much. Just I'm done with that. I will do it occasionally, but for me it's about how can we amplify the collective voice, the collective experiences, and what the pain points, what really matters to patients. So thank you to every single one of you. So many people you in chat that have been guests are just amazing, because very often when you interview for podcasts and stuff like that, people will be a guest and then they're gone again and they might not even listen to an episode. So it's amazing when people do that. So a big shout out to all those people in chat tonight that have been on the show and shared. And guys, if you want to get involved, or if you're a fellow researcher, medical professional, patient leader, patient organization leader, etc., and you want to come on here and talk about the work you do, anything regarding lived experience, shared decision making, people-centered healthcare, patient involvement, the stuff we've been talking about tonight as well, then please do get in touch. And as I say, I'm trying to keep raising that bar for you guys. I'm getting quite bold now. I don't know why, because I'm just setting myself up for fall. And I'm picking off emails to people that really shouldn't. They're not going to know who we are, but I don't care now, because I feel what we're doing is important enough now to get those stories on here, get those high profiles on here, and people that that might be able to make a difference and help us raise awareness. So thank you for all the lovely comments, guys. I really appreciate it. I've never seen so many positive ones, and also it's great to see you talking amongst yourselves as well. Fez, I did see your comment. I realised I brought up a window to try and get you the link to the EULAR training course, and then my face went bright white because it was a white that EULAR. I didn't have a dark mode set on the browser. I'm trying to find it for you. This isn't going to be where it is, but you'll probably find it off this website. So if you look on EULAR, they have a specific I think it's called like Patients in Research. It's a course. It's under £200. It cost me about 150, I think, off the top of my head. It takes 2 years to do. I am behind. I'm a couple of months behind. It's shock horror. like about 15 of these episodes, getting them out on the podcast. But it's been really valuable. The couple of months I have put into it, it's been really valuable, Fez. So I would suggest that. And also at the end of that, there is an exam, but the reward is that you actually are then recognised as a EULAR patient research partner, which I don't know about you, that feels like a really valuable thing. If nothing else, is good for your CV, mate. So check that out. If you've done the NHS peer leadership, that felt like the next logical step to me. The other one I'm keeping an eye out for as well is the is it UPATI training program. I'm really gutted I missed it. I don't know if Barry's still with us. Barry's done that and could probably answer more on that than me. Sorry guys, we're going deep advocacy talk here, but never mind. That one I missed by a fraction, but I think that's a really good one for getting connections with patient leaders around the world as well. So that's one I'm keeping an eye out. I keep missing that. They'll put on LinkedIn that it's available for applications, and then somehow I miss it by a week. So that probably says more about me and my organizational skills than their application windows. So go check out that one with you, Patty, as well. But yeah, the EULAR one I'd recommend, because for 100 quid or so, I know money's tight at the minute, but in terms of like, I couldn't remember the last time I invested in myself. I spend £40 a month running a bloody Minecraft server, for goodness sake. I thought the least I could do is chuck 3 months worth of that into my own development. So go check that out, Fez. But I'll try and find you a proper link. But yeah, the UPATI training one, Barry, I'm gutted. If you see that open up again, Barry, please tell me, because that one just feels made for what I just feel like I should be doing it. I've got no time. Just ask my son tonight when he's crying because I can't put him to bed. My God, that sounds depressing. But it feels like something I should do. So guys, I'm going to wrap up there because it's been a very long week. We have straight. So let's summarize. This isn't me like trying to pat myself on the back. It's literally trying to keep me sane. We've done a 9-hour stream for Word Day on Monday. That was after streaming 10 hours over the weekend prior to that. We went to NADEX. I'm trustee for Enable to Parent, which was awesome. I got to meet some of my sort of heroes in the disability community, which is awesome. I also felt accepted for the first time, which is weird because I was there and I had people who I knew, and that was a good sort of, that filled my cup up a little bit as well. I've had a couple of projects going on as well that I can't talk about. By the way, keep an eye out for the 1st of April, guys. There's the WebMD film documentary thing coming out about me, which I'm really nervous because I've not seen the final edit, but I really hope it helps. It's very much about what we do here, peer support, and how I use gaming to escape chronic pain a bit, and all that sort of thing. I just saw the message from Sin. Welcome in, Sin. I hope you're good. That's coming out as well. But yeah, I'm going to take a night off tomorrow night, go see some music with my brother, and then be back on Thursday on the grind. But until next time, guys, have a great rest of your week. It's not really a lot left, is there? Thanks for being awesome as ever. And yeah, I will see you soon, but not next Sunday. It's Easter. I will see you the Sunday after that for the Chronic Pain Club here. Don't forget to hit that subscribe button so you get notified when we go live, or hit follow wherever you're watching. And until next time, guys, look after yourselves and lean on us if you need us. Bye-bye.